So for our patient today, what I like to do is start simple and then see how these treatments work to make someone feel refreshed. So what we're going to do is add a little bit of volume to where she's lost some volume, not a lot, but just enough to re-enhance her cheekbone, to bring her cheekbone back. We're going to soften the little wrinkles that are developing from her forehead muscle, around her eyes, and her glabella area, or the scalding frown face. And then we're going to add a little bit in her lips to help kind of bring out that pinkness in her lips, just to kind of balance her face so that it feels more rejuvenated and younger. So we finished doing the filler, and now we're going to do the neuromodulator. In this case, we're using BOTOX today. And so we're going to treat her forehead wrinkles, or the little lines that you can see even when she's not making expression. And we're going to treat the glabella, or the frown lines. Some people call it the 11 lines, the 1 line, or the 111 lines, depending on how much expression you have. Most of the time after we do this, there's a little bump that goes away in about 10 to 15 minutes. And that's just from using saline, which is like salt water, to help dilute the neuromodulator. The product itself will kick in about 7 to 14 days. Some people it's a little bit sooner, some people it's a little bit later, but on average 7 to 14 days. So most people at this point will go home and start staring at their face and nothing will happen, and that's completely normal. By the time you get tired of doing that, then it kicks in. That's about the timing. It takes about 3 months, maybe 3 to 4 months for it to last and then wear off slowly and gradually. So you'll start noticing some gradual movement come back. At that point, you go ahead and get another touch-up so you can relax the muscles so that the wrinkles that are made from that muscle activity don't cause a more permanent wrinkle in your face. My philosophy is the best wrinkle to treat is one that's not there. So maintaining your skin at an early age is going to help you in the long run, because it's going to be less work for you to keep good looking skin. Some of the things that I didn't mention earlier that we can do is lift the brow slightly by doing a lateral brow chemical lift, which I like because it kind of just brightens the eye. So that's what we did for our patient today too. Hope you enjoyed it. Do you have any questions?
No,
You've been awesome.
Great. Thank you.
Thank you for tuning in.